Hi everyone, I'm Dr. Danielle Campaign, your American Ambulance Medical Director. I'm 6 feet apart, so I'm going to go ahead and take off my mask. But I'm here today to talk to you about COVID. I know you guys have heard a lot about COVID, and that's all we eat, sleep, and drink nowadays. But one thing I want to mention is that the surge is back. So we always talked about, when we first began that we were going to get a surge, and we got that over the summer. And then we talked about for the second surge might be coming, and as you're experiencing, it's here. The hospitals are getting full. You'll notice that with lots of EMS waits, trying to get your patients delivered to the hospital, lots of 911 calls. You're very busy. It's a very busy system. And so everyone's feeling that strain and that pressure. So I'm here today to please remind you to be diligent. Please follow the PPE policy completely. We aim to take care of you, the healthcare provider, and to take care of our patients. And to do that, we need to have you to be completely covered in your PPE on every patient contact. So just a reminder, that's wearing your N95, that's wearing your approved eye protection, which is goggles or a face mask, your gown and your gloves on your patient contacts. Now you sometimes will show up in the hospital and you're wearing all your gowns and gloves and your N95, and some of the medics have approached me and said, but I look next to me and there's some doctor wearing just a surgical mask or some nurse that's wearing just a surgical mask, even though they're in a warm zone or a COVID zone. And my advice to you is, we want the standard for you to be the utmost highest to protect you. Do not lower yourself to their standard. They may have a belief that says that they don't want to wear that mask, or they have some reason for that, but that is not for you, and that is not our company policy. As your medical director, it's my job to ensure that we are providing you with the best amount of PPE to keep you safe, and that is your N95. I myself wear my N95 the whole entire shift, and so you will always find me an N95 when in the hospital. So I would advise you that when you're in a hospital setting, when there's COVID patients around, when you're touching a patient, when you're in a patient zone, you're going to be wearing the N95. Now, say you're just in an enclosed space. Say you're with your partner in the cab of the ambulance. Say you're in at the stations. You need to be in your surgical mask. So these surgical masks are really important. They help prevent the spread of this virus. And they also help ensure that you don't bring it home to your family. So I know we've gotten a little lax over the past couple months. I think everyone has, because of the COVID volume went down. Well, it's back. It's higher than ever. It's higher than it was in the summer. And to preserve our workforce, to be able to take care of our patients, take care of our family members, we need you to stay healthy. So to do that, please wear your mask, follow the policy, and surgical mask when you're in the cab with your partner, surgical mask, and you cannot be 6 feet apart or in an enclosed space. So that way, if you're in the station, you're walking around headquarters, you need to be in a surgical mask at all times. Everyone got their flu shot, it looks like. We almost approached 500, which is amazing. Thank you so much, American Ambulance. That means we achieved herd immunity. If you haven't gotten it, I think Cindy still has a few more, so please see her about that. I also want to touch base on, after you take care of that COVID patient and drop them off the hospital, be very careful when you doff your gear. Remember, this is infected gear, so you got to get rid of that mask, get rid of that gown and those gloves in a safe manner, wipe down your units. Be very diligent about this. Don't skip over these processes. It helps prevent you from getting COVID on the next case or giving it to the next patient you pick up. And so these are very important processes. You guys have all been doing amazing about it, so I want to thank you. Thank you also for your service. Thank you for protecting our community. Thank you for being out there on the front lines day after day for the last 9 months. I appreciate everything you guys do, and I'm here for you. If you have any questions, call me, email me. We're all in this together, and keep wearing your mask.